A little bit of my background. I used to work for AFSCIO in Milwaukee many years ago. Seems like a long time ago. So my background is in labor. I've always been active in. So what I got involved with is as I aged, I got interested more and more into Medicare and what it means. As I talked to people, I've been around healthcare. I negotiate public sector unions negotiate healthcare issues at the bargaining table until Act 10 wiped out my business, which is basically the only fire and police, and they can't bargain very much about healthcare. So it's pretty well a non-negotiable issue, the reality of it. So I got involved in Medicare because I saw, as I talked to people, it wasn't a real good understanding. If you look at the sheet, it's sort of like an alphabet soup. I know everybody talking. There's Part A, there's Part B, there's Part C, there's Part D, and you can go down the whole list and do that. I just want to sort of touch on some things in the broad sense, so you just have some idea of what this topic means. Okay, if you talk about Part A, hospital, or Part B, medical, that in the industry is called original Medicare. That is original Medicare, okay? Now, give you some idea, original Medicare, okay, has two components, A, hospital, and if you have enough orders, you get it for no premium. Part B, if you depend on when you retire, okay, or when you become eligible for Medicare. This year's premium is $134 a month. That's what you pay for Part B, which is the medical side, doctors and tests and all of that. However, just so you get an idea, Part A, hospitalization, there's a $1,316 deductible for every time you go into the hospital. So while it's free for premium, it has a cost every time you go in. So that's an expense that the retiree, the Medicare eligible person has to cover. In Part B, Medicare only pays 80% of the allowable cost. The patient has to pay the other 20%. So there's also a $183 deductible this year. It changes every year. So there's an upfront deductible. So how do people deal with this? Well, one of them is, you probably all heard about med subs or Medigap plans. They cover what Medicare doesn't, and they're available in the state. I think there's 17 plans. The state regulates it, so it's a little different. It has benefits in it that aren't there. So those are the kinds of things I cover in these discussions, because most people really don't understand it, or they know a little bit of it. I always tell myself, remember, a little bit of knowledge is dangerous, so you try to get into it. Another one, Part D, another piece. That's been around for a while. It's basically a Medicare Advantage plan with a prescription drug included in it. During October 15th to December 7th, which is the annual open enrollment period, if you haven't seen it on TV and you haven't had friends, parents, relatives that get stacks of mail advertising all of this, this is the intensive period during this period of time. And so those are when I spend time talking about what you can do and what you can't do. You know, in most health insurances, you have an ability to join them, and then after that, you have to be what they call underwriting. They can review you. That's a lot of the issues with the ACA. You were guaranteed an issue regardless of what your health status was. Okay? Well, that also plays out in Medicare, because most people don't understand it or make decisions. So I cover those kinds of things. in that. I also help people go through Part D. By the way, you're required to have Part D, and if you fail to sign up during that open enrollment period when you first come to become Medicare eligible, you can be surcharged an extra 1% per month for every month you do not join. So in theory, you waited 3 years, you would have a 36% surcharge on the cost of that premium based on one. It would be 36% of the number that's the national average for prescription drug plans. So it's not just the plan you pick, but it's that, and it stays with you for the rest of your life. You don't ever lose it. So there's people. But there's a way to do it. There's a way to, tomorrow we talk about it. Senior care, $30 a year. You are now covered an incredible plan. Works good for people who get maybe their drugs through the VA. Okay, so they say, why would I want to spend $30 a month on a prescription? So we cover those kinds of things. I do analysis of what the best prescription drug plan is. There's actually a program in Medicare.gov. You put your meds in and use it, and it comes back out, and it will list from the top, the least costly plan to you to the most, and print it out so you can pick it. So those are other things. So those are the kinds of things that I spend time with, and I try to tailor it to the audience. I have a handout that I do so that I get some idea of the makeup of the group, because it's different for people that are just aging in as opposed to people that are already in Medicare and their ability to move around. So that's sort of what I do. You got my contact number. I don't think I violated my time rules too much, and made sure that I said that I stayed within it. And like I say, get a hold of me. Be glad to do programs